Today I'm going to talk about macular degeneration. I came up with this topic mostly because my grandma has this and she's 95 years old. And I just wanted to learn more about the disease and see if there is any treatment that my doctors overlooked or maybe my family overlooked. Macular degeneration is actually the leading cause for irreversible blindness for people over 60. It can make life much more difficult, and it can lead to falling, which is common among the elderly, depression, and a need for home care. Really limits the lifestyle. My grandma has had increased difficulty caring for herself, which is a problem for her because she's always valued her independence. She can no longer cook or drive. She almost can't read anything unless it's really big and right in front of her. She can't really see much being close to large screen TVs either. She says she likes to watch the reporters she knows because she knows what they look like. So the main risk factor is age. It's funny that age can be a risk factor because it's something you can't change. But there's another risk factor that you can't change, and that's your genetics and your ethnicity. In our population over 80, it is 6 times more likely to get age-related macular degeneration if you're white. And this is because there are polymorphic genes. That means genes that can have single nucleotide changes that encode for enzymes in the biosynthesis of melanin, which is the chemical that is produced and makes a darker skin color. In white people, the biosynthesis of L-DOPA is decreased because of mutations in enzymes in that pathway. And this causes lighter skin, and it also causes a higher risk for macular degeneration. Not super necessary to know that information, but I thought it was interesting. There are some factors that you can control to reduce your risk of macular degeneration, and one of those risks is smoking and also high cholesterol. Now, there are 2 types of age-related macular degeneration. One is called a dry or non-neovascular macular degeneration, and this is 80 to 85% of the cases. And this is the type that my grandma has. There are accumulations of little particles in the eye near the macula that are called drusen, and there aren't any treatment options for dry macular degeneration, unfortunately. Although there are supplements that have been shown to slow the progression of dry macular degeneration. And there is a lot of research going on to try and regenerate the retinal cells that are damaged during macular degeneration. The other type of macular degeneration is the wet or neovascular type, and this can progress from the dry type. This type involves new growth of blood vessels after the release of a protein called VEGF. And these new blood vessels are weak and often leak fluids that have bad effects on a person's vision. There is a treatment for this type of macular degeneration, and it involves using an anti-VEGF antibody to neutralize that protein in the body. This VEGF protein signals for angiogenesis. Thermal laser therapy is also an option for wet macular degeneration, or even something called photodynamic therapy. It might be wise to consult a low vision specialist, or you could use something like Orcam, which is a neat device that allows a visually impaired person to read, identify colors, and identify objects. People over 55 should get their eyes checked regularly so that they are prepared to do what they can to slow the progression of this disease if it does happen in them. All right, that's all I have about macular degeneration. Take care. Bye.